Welcome to the Hey Gen podcast. Today we're diving into the fascinating world of central airway obstruction. Let's get started.
Yeah, this is such an important topic. So, what exactly is central airway obstruction?
Well, central airway obstruction, or CAO, happens when the main airways, like the trachea and main bronchi, get blocked.
Right.
It can make breathing really difficult and can even be life-threatening if not treated promptly.
Wow, that's serious. What causes this kind of obstruction?
It's interesting because CAO can be caused by both malignant factors, like tumors, and non-malignant ones, such as scar tissue from previous intubations. The incidence is actually rising due to the increase in lung cancer cases.
So both cancerous and non-cancerous causes?
Exactly. And with more medical procedures involving artificial airways, we're seeing more benign cases too.
Yeah,
It's becoming a significant concern in respiratory care.
that's really concerning. How do patients usually present when they have CAO?
Patients might experience anything from mild shortness of breath to severe respiratory distress. Some might have wheezing, stridor, or even respiratory failure in extreme cases.
Stridor. That's that high-pitched sound when breathing, right?
Exactly. It's often a sign of significant airway narrowing. But the tricky part is that symptoms might not appear until the airway is narrowed by more than 50%.
Wow.
That means early detection can be really challenging.
So people might not realize they have an issue until it's quite severe?
Precisely. That's why imaging studies and bronchoscopy are so important for diagnosis.
Right.
They help us visualize the airway and determine the extent of the obstruction.
Once diagnosed, what are the treatment options available?
There are several, actually. It's like having a toolbox with different tools for different problems.
Yeah.
Treatments range from airway dilation and stenting to laser therapy and cryotherapy.
Cryotherapy? That's using extreme cold to destroy tissue, right?
Yes, exactly. It's one of the options, especially for certain types of lesions.
Interesting.
Then there's also photodynamic therapy, which uses light-activated drugs to kill cancer cells.
That sounds advanced. Are these treatments generally safe?
Generally, yes, but they all have risks. For example, stents can migrate or cause granulation tissue. It's
see.
essential to tailor the treatment to the individual patient's condition.
That makes sense. Are there any challenges in managing CAO?
Well, one big challenge is that there aren't many large, randomized studies comparing treatments.
Right.
It's tough to conduct such studies due to the severity and variability of cases.
So clinicians rely on experience in smaller studies?
Exactly. Multidisciplinary teams are crucial. Pulmonologists, thoracic surgeons, oncologists, all working together. It ensures patients get the most comprehensive care possible.
That's really important. What about after treatment? Is follow-up care necessary?
Absolutely. Post-intervention care is vital to monitor for complications and ensure the airway remains open.
Right.
Patients need education on symptoms that should prompt immediate attention.
Speaking of the future, are there any promising developments in CAO management?
Yes, there's ongoing research into better stent materials, like bioabsorbable stents, and more targeted therapies.
Exciting.
The goal is to improve outcomes and reduce complications.
That's encouraging to hear. Any final thoughts on CAO?
Just that awareness is key. Early detection and a multidisciplinary approach can make a huge difference. It's been great discussing this with you.
Likewise. Thanks for shedding light on such an important topic.